Malignancy of the breast tissue or tumors inside the breast are called breast cancer. All across the world, it is mostly women who are affected by it. Dr. T. Raja is a consultant medical oncologist at Apollo Specialty Hospital. Is there a particular age group of women who are likely to get breast cancer?
Breast cancer can happen in any age group. Little broader limits are there, but the most common incidence is seen in the age 50 to 60, but age 40 above we start screening them very actively. But breast cancer can happen, we have seen breast cancer from age 30. The upper limit of age is also not defined, they can appear at 60, 70, but the most common age group I would say is 40 to 60.
One in how many women are affected by breast cancer?
The Indian statistics are not very accurate because obviously the entire population is not completely covered by authentic data, but we think the statistics could be somewhere between 1 in 6 to 1 in 8 women may be afflicted with breast cancer.
What leads to breast cancer?
The breast cancer is basically a change in the cells within the breast. There are a number of factors that can be attributed as a cause to the breast cancer. There are some factors which are called social factors, that includes the age and their diet pattern, obesity. There are some factors which are innate, that is something like a genetic. I mean not hereditary but genetic. There is a change in the genes in the cells that leads to breast cancer. There are some clear-cut hereditary predisposition. In some families breast cancer runs in families, but most of the common breast cancers are acquired breast cancers. They don't run in the family.
When should a woman take the cue to visit a doctor?
As far as the women health goes, there are two important aspects. One is awareness. They need to be aware that such a disorder is there, and it is a common malignancy. And every year in India, it is estimated that nearly 100,000 women get breast cancer. That is the incidence that is known to happen in India. Now, they should be doing self-examination on their own. All women should learn. It's a very simple technique they should learn, and they should start examining themselves from the age of 30. And from the age of 40, they should undergo a test called mammogram as a screening at some regular intervals. Whenever there is a lump or whenever there is a change in the breast, when the size of the breast changes, or when there are some skin changes, when there is a change in the nipple, when the nipples are indrawn, and if both the breasts look different between each other, and if there is an asymmetry, then they should better consult a local physician or a surgeon or an oncologist.
How effective is mammography in diagnosing breast cancer?
Mammography is a very simple technique and it is very effective, and it picks up even very early breast cancers. It's a very important screening tool. There are some patients wherein there will be some debate after a mammography, there will be some difficulties and doubts in concluding, but most of the patients, the breast cancer can be reliably diagnosed with mammography. The mammography changes are classified as based on what we call Birard score, and any patient who has got a Birard score of 4 is definitely considered as a possible breast cancer, and the patients who have benign lesions will have a lower Birard score.
What is the nature of treatment for breast cancer?
Most breast cancers are treated by 3 important modalities. One is surgery, the next important modality is chemotherapy, and the other important modality is radiotherapy. In some patients we need to do hormonal therapy. In every patient, depending on the stage at which they present and depending on the hormone receptors that are expressed on the cancer cell, we decide whether the patient needs to undergo chemotherapy or hormonal therapy, and depending on their size and lymph nodal status, we decide whether the patient needs radiation or not. The patients invariably undergo some form of surgery, either they undergo a complete removal of breast or sometimes the lump alone is removed and the breast is preserved.
Share some of the concerns a counselor might touch on when handing the report to a person diagnosed with breast cancer.
There are many concerns. A woman is immediately affected by the very word and the very diagnosis of breast cancer. Their life comes to a, if not a standstill, but the life has to be halted, and then we have to look at how to treat at that point. They are offered treatment in the form of surgery, radiation, chemotherapy, so they are taken out of their routine and they are taken out of their day-to-day life, and to some extent their job and everything is not exactly completely affected, but is definitely hindered, and they go through the hassles of the treatment and the visits and the consultation, etc. But after an intense period of 4 to 6 weeks of evaluation and treatment, another 4 to 6 months of full-fledged treatment and follow-up, they are back to normal life and they can do everything they want, just that they have to be in follow-up at some regular intervals.
How can breast cancer be prevented?
There are no clear identified ways of preventing a breast cancer, but there are some common lifestyle modifications that can help. It is considered that if the women have children at a relatively earlier age, or do not have children at a very late age, and if they can reduce the obesity and if they can reduce their fat intake and be active and exercise, it helps in reducing the breast cancer incidence. The other strategy is that to be attentive and to be aware of the disease so that they can come to diagnosis at an earlier stage. These are the two important concepts we want to express.
In the fight against breast cancer, what calls for immediate attention?
Once the diagnosis is done or the diagnosis is suspected, it is better to reach a comprehensive center wherein all the modalities of treatment like surgery, chemotherapy and radiation and a good radiological setup is available, so that their evaluation is complete and thorough, and a good histopathology is essential, and then a good treatment plan is done at the upfront, and the outcome can be better if everything is planned at the outset, rather than if you work out in smaller places in part, better than that to be in a comprehensive center.